The mission of the Elizabeth Hospice is to enhance the quality of life for those nearing the end of life's journey and for those who grieve. Betty Bulin is the primary founder of the Elizabeth Hospice. She put out a call to action to the community, asking anybody who was interested in helping make care for the dying better to come to a meeting, and 50 people showed up. 50. I think that's extremely impressive that 50 people can get anywhere. My name is Laura Miller, and I'm the president and CEO of the Elizabeth Hospice. They hired me because I had worked for so long with people with chronic illness. I've been part of a growing industry, in a sense that more and more people are recognizing what hospice is. We really want people to participate in their own care and to tell us what it is they want, what it is they want to achieve.
My name is Greg Rice, and I am a social worker with the Elizabeth Hospice. And I was assigned to the case of Phyllis Avance and her family. Phyllis is an 84-year-old woman who has laryngeal cancer and lives at home with her daughter here in Carlsbad.
I never wanted to think, even before this happened, that my mom would ever need to go into any kind of long-term care situation. And yet when this happened, the level of care she needed was so intense.
Saying goodbye to somebody that you love is incredibly hard.
I think a lot of trust has developed on Phyllis's part, and as well as Phyllis's family, as they've kind of led us into that very intimate space at this time in their lives.
The first and foremost thing is you're a guest in someone's home, and that those people in that home, the patient, the family, they really tell you what it is they want and need.
Having somebody to help you walk through that valley and knowing where that valley is going to transit that person, and having somebody there to encourage you and comfort you and guide you and direct you, and then being able to turn around and give that guidance and comfort and care to her, you know, that helps alleviate her fears. And that's what we've tried to do, is to let her know, Mom, it's okay, we're going to be here.
I believe that it's the best way for families to support a loved one who is going through this final phase of their own life. Over the years, we really wanted everybody in the North County to know what this service is and how they could access it. And we've done everything we possibly can to get the word out to individuals, and that's been my journey. The Elizabeth Hospice is a not-for-profit organization. As a not-for-profit, we are a community partner. As a community partner, we are governed by a board of volunteer directors. People from our community in all walks of life volunteer their time monthly to support the Elizabeth Hospice and to provide leadership and strategic direction for our organization.
My name is Beth Nito, and I am the Community Resource Supervisor for the Elizabeth Hospice. I have 20 direct reports, and most of these people are out in the community, spreading the word about hospice, educating physician and medical groups about what the hospice benefit is, and answering their questions, and also putting to bed a lot of myths about hospice. We have staff here that's specially trained, and they know exactly what to ask and advocate for families.
We had 5 staff when I started, and now we're not quite at 200, but pushing 200 staff.
It's really about the holistic approach, and the focus is bigger and beyond just the patient. My name is Veronica Jerome Stone, and I am the clinical team facilitator for the admissions department.
We're here, we're dedicated to meet the needs of everybody. We've never turned anybody away based on their financial situation.
There's a real draw to doing this type of work because I think we find that we really make a difference.
My name is Patty Shader, and I'm Director of Program Services. As Director of Program Services, I'm responsible for the clinical services staff, those who are taking care of the patients out there in the field. I'm also responsible for the volunteers, the community education staff, and the bereavement staff.
My name is Cecilia Ty Johnson,
and I am the bereavement coordinator here at Elizabeth Hospice. Reaching out is scary. It's an unknown, and it is like dying. It's you don't know what to expect. You don't know, and if you haven't been through it before and you haven't had anybody help you with that journey, it's difficult to reach out and take a stranger's hand.
They gave me time to believe in myself. They gave me time to come into my own and to know that, yes, with their help, and the rest of your family's help, you can do it.
What we say in hospice, especially the Elizabeth Hospice, is it was a difficult death with us there. Can you imagine how difficult it would have been for this patient and family if we weren't there?
They were there all the time, and that just meant everything. Everything.
I'm Karen Johnson, and I'm the Clinical Education Coordinator.
I'm Kay Evanson, a registered nurse and case manager. You actually get to know their feelings and know their wants and their desires, and try to help them carry it out.
And to build those rapport and to have that relationship, the death can actually be a very positive experience, and it's a very rewarding experience.
I'm very fortunate to have an absolutely wonderful team of nurses and physicians and social workers and counselors and volunteers that actually go out and represent the hospice out in our community by taking care of patients and families. Many of us, when we come in here, our first day or first week or first month, we don't know if we have what it takes to take care of people.
And for them to just hold your hand and with their soft-spoken words they say, "Thank you very much for all what you've done." That's pretty rewarding for me. Hi, I'm Flori Delphin, and I'm one of the RN case manager for the West team. It takes a special person to do this job too, because you got to be compassionate. Yeah.
Nurses at the Elizabeth Hospice have the opportunity to care for the whole patient, providing holistic care in that they not only take care of the physical person, but also their mental, spiritual, and emotional needs.
Working in hospice is totally different. It involves all the emotions.
This is just such a needed specialty in the healthcare profession and in nursing. My name is Catherine Webb. I'm an RN and a case manager here at the Elizabeth Hospice.
We coordinate the care of the patient with the other disciplines, the chaplains, social workers, home health aides, and homemaker, to make this a smooth, comfortable life for the patient and a smooth transition to their death.
My name is Dr. Nicholas Jareggi. I'm a family physician and a hospice and palliative care physician. It's very fulfilling as a hospice doctor or as a hospice nurse to really make a difference in somebody's life, to really help them when they're most needy, and that is at the end of life. They're losing everything, and you have the opportunity to make a difference in that, to really bring some joy into and a light into a place where it's very dark sometimes.
I go home happy, and they bring a lot out of me. My name is Rowena Osowski, and my title is a Certified Hospice and Palliative Nursing Assistant. I guess you just have to experience being with hospice.
We end up learning more and more about ourselves, and I truly believe we become better people.
The reason I have chosen to be with hospice is because it has taught me how to live.
Our social workers all have a common purpose. They desire to have our patients have a safe, comfortable life that is fulfilling for them until their death.
As a medical social worker, one of my jobs is to make sure that people can die with dignity in their own homes.
My name is Lupita Gaona White, and I'm a social worker with the Elizabeth Hospice.
We, from the depths of our hearts, want to be available to people who are in the last months of their lives.
We go there to normalize their feelings.
I walk in every day and I feel a sense of pride to work with this group of professionals. My name is Andrea Schwarb. I'm a medical social worker.
It's a real critical time in people's lives. It's intimate, it's sometimes very crisis-centered, it's very urgent, and the whole purpose of me coming in there is to kind of create a sense of calm and create a sense of confidence that the family can have the courage they need to take that final step with their loved one.
They help build the bridge of relationship within the family to how to support one another too, to where we all together could do it, because I couldn't do it on my own.
We come into hospice and we're astounded at what happens to us in this experience with people. We are profoundly deepened in that experience, no question about it. My name is Alan Pickering. I'm a chaplain with Elizabeth Hospice.
Our chaplains are Masters of Divinity prepared ministers of their particular faith. Their role is not to project their spiritual beliefs onto the patient, but rather meet them where they are at spiritually and help them along their journey.
My name is Jeff Lee. I'm a chaplain with the Elizabeth Hospice. My job is very important as a hospice chaplain. To me, I'm in a position to provide support because there's nothing else science, medicine can do at that point.
I'm very honored to be in charge of this group of people, all very dedicated and very talented individuals. Every day is different. Every day is a challenge. We just meet incredible people, and I like that, and I don't think I can find that anywhere else.
Hospice provides that sanctuary where the family can enjoy each other up till the last breath.
We are that organization that understands and has the right tools to help.
There are patients right here in our community that we want to serve. We're not trying to be everything to everybody. The staff feel that it's a place that we're coming in and out of every day to offer each other support, to offer collaboration, to tap into the other person's expertise and go out and serve our patients in our immediate community. And I think that's what makes our reputation a good one, because we're about our community.
It's a remarkable, remarkable organization. It's like a family.
They need to know that that we're with them for the entire journey, that we won't back out midway through, no matter how hard or how uneven the road gets. We're there at any time, day or night. They just need to call. They need to know that there is somebody at the other end of that telephone.
If you're facing a life-threatening illness, if your loved one has a terminal illness, this is a really difficult time. And I would just encourage you to pick up the phone and receive some information from the Elizabeth Hospice to really help you know all of your options and be able to receive some really vital services in this very difficult time.
People can contact us at 760-737-2050, 24 hours a day, 7 days a week.
We are here.
Compassion in service.
From our family to yours.
Log on to elizabethhospice.org